New CDC director confirmed. What it means for public health. In an unprecedented move, the Senate has greenlit a new leader for the Centers for Disease Control and Prevention, CDC. This isn't just any appointment. It's a seismic shift that could reshape the future of public health in America. Susan Monarez, a seasoned health scientist and dedicated civil servant, has been confirmed as the new director, marking a historic first under a 2023 law. But here's where it gets controversial. Monarez is the first to take the helm without a medical degree in over 7 decades. The vote was a stark 51-47, strictly along party lines, reflecting the deep divisions in our political landscape. Kayla Bartkowski, Getty Images. Imagine this. For months, the CDC has been navigating turbulent waters, battling staffing cuts and disease outbreaks without a steady hand at the wheel. Now, finally, they have a captain. But the ship is far from smooth sailing. Thousands of workers have jumped ship, and support for many programs has been slashed. To make matters worse, President Trump has proposed drastic funding cuts for the CDC in the upcoming fiscal year. It's a perfect storm of challenges awaiting Monarez. But who is Susan Monarez, and why is her appointment so significant? Monarez is no stranger to the world of public health. She's a microbiologist and immunologist by training, with a proven track record of leading with evidence and pragmatism. She served as the CDC's acting director and has been a key player in cutting-edge biomedical research. But this is the part most people miss. Her nomination came after Trump withdrew his first pick, Dave Weldon, due to concerns about his stance on vaccines. Monarez, on the other hand, is a staunch advocate for vaccines and public health. In her confirmation hearing, Monarez laid out her priorities with clarity and conviction. She vowed to restore trust in the CDC by making leadership more transparent and accountable. She promised to modernize public health infrastructure and respond rapidly to disease outbreaks. But here's the kicker. She also hinted at a shift in focus, aligning more closely with the administration's agenda. And this is the part that could spark some heated debates. She suggested that programs focusing on chronic diseases, obesity, depression, and drug addiction might be transitioned to other parts of the Department of Health and Human Services, HHS. Is this a necessary refocus or a dangerous narrowing of the CDC's mission? The jury is still out. Monarez's appointment comes at a time when the CDC is grappling with deep staffing cuts, funding clawbacks, and a clampdown on communications. Morale is at an all-time low, and the agency is reeling from the loss of about 1/3 of its staff since January. More changes, including budget cuts, are on the horizon as part of an ongoing reorganization effort. But is this the right move? Some experts argue that a true public health agency should consider all risks, from infectious diseases to environmental factors. Others see this as a necessary refocus on the CDC's core mission. What do you think? Should the CDC narrow its focus, or is this a short-sighted move that could have dire consequences? The floor is yours. Let's hear your thoughts in the comments. Meet Dr. Susan Monarez, new CDC director with Wisconsin roots and a unique background. Meet Susan Monarez, the new director of the CDC, a woman with an intriguing background that's stirring up some conversation. Born and raised on a dairy farm in rural Wisconsin, Monarez has come a long way from her humble beginnings. She holds not 1, but 2 degrees from the prestigious University of Wisconsin-Madison, both in microbiology and immunology. It's a unique path that's caught people's attention, especially since she's the first CDC director in over 70 years without a medical degree. But don't let that fool you. She's spent her career in the health field. But here's where it gets controversial. Monarez was confirmed by the US Senate with a razor-thin margin of 51-47, strictly along party lines. She wasn't even the first choice for the job. That was former Republican Congressman Dave Weldon of Florida, who was dropped due to heavy criticism. Monarez has already had a taste of the director's role, serving as the CDC's acting director earlier this year before being officially appointed by President Trump. Now, she's stepping into the role at a critical time for the agency. She'll be working closely with Health and Human Services Secretary Robert F. Kennedy Jr. to carry out the administration's Make America Healthy Again agenda. But managing public health issues like measles won't be easy, especially with the CDC facing staff shortages and looming budget cuts. Before her new role, Monarez was the Deputy Director of the Advanced Research Projects Agency for Health, a federal agency focused on biomedical and health research. She's also had stints at the Department of Homeland Security and the White House, working in the Office of Science and Technology Policy. Monarez is known for her commitment to public health, science, and vaccines, which could lead to interesting discussions with Kennedy, who has been known to oppose long-accepted scientific and medical knowledge. And this is the part most people miss. How will Monarez's background and beliefs shape the CDC's direction? Will her commitment to science clash with Kennedy's views? What do you think? Leave your thoughts in the comments. This story was contributed to by Riley Beggin of USA Today and Madeline Heim of the Milwaukee Journal Sentinel.